these are the 9 things to stop doing to lose weight if you are currently on Ozempic, Zepbound, or any other GLP-1 for that matter. We're gonna tackle these things that might be sabotaging your results. We're gonna go over how to avoid them, how to actually use GLP-1s in the right way. Let's go ahead and jump into it together. My name is Dr. James Surrett. I'm a functional medicine doctor. I specialize in GLP-1 therapies, weight loss, and getting to the root cause of people's issues so we can lose weight in a sustainable way, remove the roadblocks, and not make you dependent on these GLP-1s forever. The number one thing I would encourage both patients and providers to stop doing is going into these medications blindly. No blood work, no testing means no place to stand in terms of where someone is starting. So if you come to me and you want to lose weight and I just prescribe you a GLP-1, we really have no idea why you gained the weight to begin with, where you stand metabolically, and to just jump into treatment like that, we lose the ability to track you over time. Obviously, we want you to lose weight, but we want you to also look better on paper, healthier in every other department of your life from a longevity perspective. Think, like, if you're only focused on the scale, then you're missing the actual reason why your metabolism might not be working to begin with, or why you gained that weight to begin with. Things like high inflammation, blood sugar issues. We always check fasting insulin, A1C, and other blood sugar markers to just know how insulin resistant you are to begin with. Other issues that could be present are going to be like low thyroid, estrogen dominance, gut infections. These things can completely block weight loss for people. The bottom line is without labs, you're just guessing. And how do we know you need to move up in dosage when it's actually not just some other functional problem that's preventing the GLP-1 from working to begin with? Each and every patient that we work with, we run a full functional panel within our program, and it changes everything. It really speeds up the process. If you are somebody who is interested in blood work like this, please click the link down below to apply to work with us. The second tip I cannot stress enough, this is for both doctors and patients alike. If you are losing weight on a GLP-1 at a specific dosage, and you have no side effects or limited side effects, and you are losing weight every week, and your doctor goes to bump you up in dosage, I would heavily question that. And it's worth a conversation with your provider, because every time you increase that dosage, one, you're getting more receptor stimulation, so you're increasing the body's probability of being hooked on this medication for a long time, or when you take it away, having some sort of a whiplash effect where you gain your weight back. So you want to stay on the lowest effective dosage amount. If your doctor is just following the back of the box of what it says on Ozempic or Wegovy or Zepbound or whatever medication that you're on, they all say something similar. They're all trying to move you to a higher dosage. And in doing so, this does not always yield a better result. It is more receptor stimulation. It has a higher side effect profile. So if you are on this medication and you are already being successful and your doctor is saying, hey, it's time to move you up, then stop for a second and have a meaningful conversation with your doctor. If they're still wanting to increase you, it may be time to find somebody else who is willing to prescribe you this medication or work with you one-to-one. Weight loss should not be a cookie cutter template, and neither should your GLP-1 medication. Let's just say that you are on 2.5 milligrams of tirzepatide, 5 milligrams of tirzepatide, and your doctor's wanting to move you to the next dosage because you have not lost weight in a week or two. I would urge you to evaluate some of these other categories that we're going to be talking on today that might bust you past the plateau and have you continue on, march onward on your current dosage. That way, you don't have to just continually follow the ladder in order to continue to lose weight. The number 3 thing to stop doing is going to be ignoring digestive symptoms. Here are the red flags: burping, bloating, feeling overly full, acid reflux or GERD, constipation, diarrhea, gas, pain after meals. Any of these things, all of the above, are just signs that you're inflamed, and that is the inflammation that is likely killing your momentum. So your digestion is really just a mirror of what's happening with your metabolism. So many people, when I start working with them, are constipated. They're having acid reflux. They have a number of digestive symptoms that they are just considering normal. They've been struggling either with it before the GLP-1 medication or once they started, and it's like, oh, it's just a normal side effect of the medication. I would argue, no, these are things that we want to control for. Constipation. If you are not going to the bathroom each and every day, this means that you are not eliminating your toxins effectively. Those toxins, the stool, is going to sit in your intestines, and you are going to continually reabsorb these toxins, what your body is trying to eliminate. You can see how that may not be a good thing for weight loss in the long term. We want to remove toxins and other inflammatory compounds from the body and keep inflammation as low as possible throughout this process. so we can continue to lose weight. Inflammation is kind of the death of weight loss. Inflammation will cause water retention, where water is retained in the tissues. Typically, in that state, people will tend to be more in a gaining weight type of a category. If we can limit inflammation, typically people will go in the other direction of losing weight. If you're constipated, a probiotic, psyllium husk fiber, different types of soluble fiber can be helpful. A lot of times what we'll recommend is higher protein diets for people. And so if you automatically just eat a high protein diet, low carb, then you're going to have lower amounts of fiber in your diet to begin with. So you really need to be careful of this paired with a GLP1, because all of a sudden you're going to get a little bit of slowed motility, even in a microdose. The best thing to do here is just not ignore it. Don't pretend like it's just something that's going to go away. You want to treat it. And this leads me to point number 4, which is stop drinking small amounts of water. You need to drink enough water throughout the day to even be able to promote a bowel movement. Most people that are constipated are just chronically dehydrated. I would say that's the number one thing that causes constipation on top of these medications, is going to be a lack of fiber and a lack of water. If you can correct those two things, most people will end up having bowel movements, which will speed along weight loss and break you through a plateau. How much water is the right amount of water? And you've heard the generic statements, I'm sure, from nutritionists, health coaches, other gurus online. Drink half your body weight in ounces per day. This is not the worst goal to work towards. However, just realize that if you're drinking like 1 cup of water per day, so like 8 to 12 ounces, and then you have somebody like me saying, hey, you need to be drinking 80 ounces of water a day or 100 ounces of water a day, and you start drinking a bunch of this, what it's going to happen is you're going to flush your body of minerals, and there's going to be increased demand in your body for electrolytes. So you can end up dehydrating yourself more just by drinking more water. My recommendation here is if you're like under 20 ounces of water per day, then you want to go slow. Just bump it up to 30 ounces of water a day, 40 ounces of water a day, 50 ounces of water a day. You don't have to just go from 0 to 60 all at once. The other huge question that I get with fluid intake is hey, Dr. Surratt, I drink a lot of coffee. Does that count? I drink a lot of tea. Does that count? I drink a lot of sparkling water. Does that count? No to all of the above. You need real water, preferably filtered water. The number 5 thing to stop doing is eating inflammatory foods. This is one of the easiest wins, but most people overlook this. Even on a healthy diet, if you're eating foods that you're sensitive to, like gluten, dairy, soy, nightshades, legumes, seed oils, whatever it might be, if you're inflaming your gut lining, then you are raising your cortisol, you're going to raise your blood sugar. This will cause water retention, and it will make it very difficult for you to lose weight overall. Remember, inflammation equals fat loss resistance. If you're wanting to know what food is triggering this for you, then you want to pay attention to what happens about 20 minutes after you eat. Is anything causing you to have brain fog, bloating, an energy dip, anything like that? Then that is your body talking to you, and you need to pay attention to it. Number 6 is stop skipping meals. The worst pattern that I see people fall into, this is probably 60-70% of people that I see. If you eat breakfast, skip lunch, and you're not eating again until dinner, this is a huge hit towards your metabolism. So you're not hungry, so you skip a meal. This seems logical, right? But there is a problem. Your metabolism really needs consistency to stay active. Once you are in a fed state, skipping a meal in the middle of the day will spike your cortisol. This will drop your other hormones, which can then lead to binging later in the day or eating too much at night. You really do need consistent protein throughout the day, consistent meals and protein throughout the day to help stabilize your blood sugar. Worse than this, if you're not hitting your protein goals. So eating regularly is not about calories, it's about sending your body the right signals. So the number 7 thing to stop doing is under eating on protein. This one is massive, especially for women. If you are eating under 80 grams of protein per day, then your body is going to start burning through muscle on a GLP1. It's only really a matter of time before this starts to happen. Protein will preserve your muscle, it curbs cravings, prevents you from overeating, and it also supports liver detox. But there is another reason why we care about this protein so much. 2 split reasons. One is when people lose weight, they tend to lose it from their legs, especially if you're over the age of 50, 60 years old. That muscle can be difficult to get back. You do not want to lose it to begin with because it puts you at further risk in your life for falls, further in the risk in your life for a lack of mobility, And the biggest killer of people over the age of 60 is going to be just simply a lack of mobility. You can't get around to see the people that you love, you can't exercise, and this causes life expectancy to decline. The other in the moment fundamental issue is when you don't eat enough protein, protein stabilizes your blood sugar in between meals. So if you're eating protein at each and every meal, you can expect to see lower blood sugar on trend. If you're wearing a CGM or a glucose monitor, what you will expect to see is actually less spikes throughout the day. We know for weight loss and insulin resistance, this is extremely beneficial, especially on paper when we're checking your fasting insulin levels. We do this continually throughout our programs. We want to see insulin levels under 5 ultimately. Most people are starting off from 10 to 20. And in order to chip away at this in a way that's meaningful, we have to see protein maintained throughout the day on a consistent basis. Number 8 is stop drinking alcohol if you want to see consistent fast weight loss. You cannot drink alcohol and be disappointed when you don't see good results on the scale that week. The trouble with this is that depending on how your body metabolizes alcohol, it may completely sabotage your result. For instance, I have had patients where drinking alcohol 1-2 times a week with a GLP-1 didn't matter that much. But I've also had it where drinking 1 to 3 glasses of wine, just 1 to 3 glasses of wine spread out throughout a week, and somebody literally hit all their macros perfectly. They're on all the right supplements. Their labs actually looked pretty good. They're on HRT. They literally have everything lined up. They have all the exercise. They're doing everything perfectly, but just 1 to 3 glasses of wine per week, 0 weight loss. I have seen this now in enough people to just tell you, when you start a GLP-1, please fast from alcohol for 2-3 weeks, get yourself some momentum, and then consider adding alcohol back in. And please weigh yourself the next morning so you know exactly what to expect from a drink. If you're doing everything else right but drinking alcohol, it's almost like 1 step forward, 1 step back, 1 step forward, 1 step back, and your body never really gets out of that inflammatory loop. Your body's constantly trying to fight the inflammation from the alcohol. Number 9 is stop ignoring root-caused conditions that can cause weight gain to begin with. If you go to your doctor and they tell you that you have a thyroid condition, so you're on thyroid hormone already, or they suspect some hormonal imbalance, so they just prescribe you an estrogen pill without testing anything, or you have another known issue that can cause weight gain, but nobody's really doing anything about it, they just offer you Wegovy as a solution, this is your wake-up call. The Wegovy is ultimately a Band-Aid. Am I a fan of it? Yes. It can speed up your result, gain you momentum to make the changes in your life that actually matter, but it does not change the fact that these underlying conditions like adrenal dysfunction, thyroid problems, like you need these things ironed out, and you need to be able to work with a provider that's going to look at the big picture, not just the weight loss. Remember, the weight loss is just a downstream symptom. For instance, let's say we run labs on you and your TSH is normal. I will also check the entire rest of the panel. If your active thyroid hormone is under 3, that may be the reason why you are not losing weight, because that is your metabolic rate that's determined by your active T3. That's your thyroid hormone that is bioavailable in the body, ready for use, controlling your metabolic rate. If you don't have enough of it, then it makes sense that you would not lose weight. If you are already medicated with a thyroid hormone and no one is checking this for you and your TSH is normal, that means absolutely nothing, unfortunately. It means nothing. Let's take levothyroxine. It is synthetic T4, which is inactive hormone. You take this. It is up to your body to convert the inactive T4 into active T3. Let's just say that you're taking levothyroxine and your T3 is low, you have poor conversion. What that means is you either need to be on a supplement that helps with this, or you need to add a synthetic T3 or a natural version of this product like an NP thyroid or another glandular formulation that has T4 and T3 in it. And a lot of patients respond very well to this. So anyways, you guys, GLP-1s do not fix the problem. They just buy you time and they buy you speed. And we can fix everything else going on in the background that is actually causing the problem to begin with. This is the exact approach we take inside of our program to help patients. So if you want to stop spinning your wheels, use these medications the right way, I'm happy to work with you one-on-one, but please apply in the link down below to see if it's a good fit. If you got value from this video, please smash the like button for me. Leave a comment. It really helps the channel and push this to other people that need to see it. I do have this calling, I feel like, to encourage people, let them know that they're not broken. They just don't have the right data yet or the right strategy. So if you're getting pumped on this and you want to jump more into the numbers and what this looks like inside of somebody's labs and how it applies to patients, please watch this next video where we do a full lab review with a patient and help accelerate their weight loss. Otherwise, I'll see you guys next week. Take care.